2020 coronavirus pandemic in the Philippines. As of March 16, 2020, there have been 140 confirmed cases of the coronavirus disease 2019 COVID-19 in the Philippines. Out of the 140 cases, 12 deaths were recorded. The first case was confirmed on January 30th, that of a 38-year-old Chinese woman who was confined in the San Lazaro Hospital in Manila. The second case was confirmed on February 2nd, that of a 44-year-old Chinese man who died a day earlier, which was also the first confirmed death from the disease outside mainland China. The first case of someone with no travel history abroad was confirmed on March 5th, a 62-year-old male who frequented a Muslim prayer hall in San Juan, Metro Manila, raising suspicions that a community transmission of COVID-19 is already underway in the Philippines. The man's wife was confirmed to have contracted COVID-19 on March 7, which was also the first local transmission to be confirmed. The largest increase of the number of confirmed cases was on March 14, when 34 new cases were announced. The Research Institute for Tropical Medicine (RITM) in Muntinlupa, Metro Manila, is the medical facility where suspected cases are being tested for COVID-19 infection since January 30, 2020. Prior to that date, confirmatory tests were made abroad. Several measures were imposed to mitigate the spread of COVID-19 in the Philippines, including bans on travel to mainland China, Hong Kong, Macau, and South Korea. On March 7, 2020, the Department of Health (DOH) raised its Code Red Sub-Level 1 with a recommendation to the President of the Philippines to impose a public health emergency authorizing the DOH to mobilize resources for the procurement of safety gear and the imposition of preventive quarantine measures. On March 9, President Rodrigo Duterte issued Proclamation No. 922, declaring the country under a state of public health emergency. To prevent the spread of COVID-19, on March 12, 2020, during his public address on the emergency, President Duterte declared Code Red Sub-Level 2, issuing a partial lockdown on Metro Manila and extending the metropolis class suspensions up to April 12, as recommended by the Interagency Task Force of Emerging Infectious Diseases (IATF-ED). The class suspensions were later extended up to April 14 through a memorandum circular released by Malacanang on March 14. The Philippine government has repatriated some of its citizens across different international locations, all of whom were later quarantined at the new Clark City in Tarlac.